India is battling a ferocious second wave of coronavirus. And as we see a grim milestone of over 200,000 deaths recorded in India so far, there's a tremendous pressure on the healthcare system here. There's shortage of oxygen, hospital beds, and essential medical supplies. And in this scenario, we're throwing spotlight on those who are in the front line, our health workers. And we do the show remotely. Namaste, I'm Devina Gupta. This is Work Life India, and we are asking how are health workers coping in this COVID crisis? So, joining us on this conversation, let me welcome Dr. Shashwati Sinha. She's joining us from Kolkata. She's critical care specialist at Ambry Hospital in India's Eastern City. Also joining us is Jibin TC, who's a nurse and has volunteered to work in a private hospital in COVID ward in Western Indian city of Pune. He's also the president of United Nurses Association in the Western Indian state of Maharashtra. Also with us, Dr. Roma Kumar, who's a clinical psychologist and who has been helping people deal with mental health distress during this time. So welcome all of you. I know it's a high pressure time, so I really appreciate you taking out time to talk to us about what's happening in India, to try and make sense of it. And Dr. Sinha, let me start with you, because take us through how you are dealing and your teams are dealing with this unprecedented scenario in COVID ICU wards.
The scenario in the COVID ICU is a completely mind boggling situation. Our day starts, in fact, it's hard to say when the day starts and how the previous night has ended. In fact, we are woken up by phone calls from the emergency room. A lot of our non COVID ICUs have been converted to COVID ICUs. The challenge lies in meeting the demand with the manpower or the infrastructure which we have at the present moment. Whatever, there's ultimately a finite amount of manpower in the system, and however much we try, we are not able to provide the kind of care to meet the demands of these acutely ill patients.
And Jibin, you are actually the face of hope for many patients who come to these hospitals, those fortunate enough to get space in the hospital and get that medical aid. But it's not possible to deal with the resource crunch. And how do you deal with your emotion at that point of time?
See, first of all, it's very difficult to handle this situation because when some patients and relative approach us for maybe for a medication, maybe for some health aid, we might not have the stock of some medications, and we try to get it from other sources, but ultimately at the end of the day, we fail it in that scenario. And also, like I've seen many nurses are crying, sitting and crying literally because they feel that if you could have given them some better treatment, or if you could have shift them to another hospital, we would have saved them. And personally speaking, I also feel many a times when I get calls from these patient relatives, I try my best to get arrangement done, but at the end of the day, I have to say sorry to all these people. And it's very difficult to look at the patient face and maybe the relative face to say sorry. And somehow we are managing. That's how I could tell you right now.
Coming to you, Dr. Roma Kumar, you also get distress calls from people who are looking out for any kind of help, and they're reaching out to doctors and health workers in the medical fraternity. Do you feel overwhelmed at times?
Yes, I do feel overwhelmed pretty often. But since I'm a trained mental health professional, I also have learned how to take care of myself. Only when I'm able to take care of myself will I be able to take care of the clients who are going through emotional issues. So I do make full effort to take care of them.
Can you take us through the hardest moment that you faced as a health worker in these past few weeks?
Well, it's just recently for a week now, my 19-month-old grandson has been diagnosed with COVID. The daughter-in-law has been diagnosed with COVID, and they're both apart from each other. So, it's tough situation for the family itself, how to deal with them and how to keep the little one away from the mother, and he keeps screaming. So most of the time I'm on the video chat with him so that we can connect with him and talk to him. And he's very verbal about it. So these are very, very tough moments. And then the toughest one was where I myself got COVID. Me and my husband were admitted in the hospital, and we got admitted because my 90-year-old mother was also diagnosed with COVID. So we had to admit together. And the overwhelming moments were when I saw the nurses working overtime, the doctors in their PPE kits coming and taking care, but none of them would be touching or taking care of my mother because of the COVID scare. And so I was doing everything myself, and we were there for 10 days. And that was very, very distressful.
Well, I wish speedy recovery for your grandson and his mother as well. And good to know that now you and your mother and your husband have recovered at this moment. But
Yes.
Dr. Shashwati, Roma mentioned an important point. She said that when her mother was in the ICU, doctors or nurses would not even touch her because there's a scare in their mind that the infection may travel faster to them as well. Do you see this anxiety in doctors at the moment?
Well, I guess the anxiety was much more the last year around when the pandemic had just started, and the fear of getting COVID from patients, and the initial apprehension to go near and touch patients. That was very evident in the initial part of the pandemic. But my nurses and the entire team of doctors, including myself, we have actually we nurse the patients, we go near the patients, even if we have gloved hands, we hold their hands, and we really try our best to make them feel, to allay their anxiety, because we know what they're going through. All of us know that there is a realistic chance, and many of our healthcare workers have been affected. In fact, last year, during the peak of the pandemic, six of my nurses got affected together. And but still, despite all the odds, I think my nurses have done a wonderful job. We do try and maintain a safe distance while talking to them, or if somebody is having a bout of cough, we do take the necessary precautions. But there is no nursing maneuver which is not done by my nurses for the COVID patients.
Mhm. But Jibin, as I was speaking to one of the nurses in a private hospital in Delhi, who said that we're not sure about the quality of equipment that we are given. The PPE kits that we are given, sometimes they smell, some of them are torn, and it's very difficult then to serve people and do their duty as well. Are you seeing these instances in Pune as well, where you are? And how do you overcome these challenges?
Yes, there is a fear in that case because even when I look at a PP kit, majorly nowadays, it does not have any label in it, or it does not tell you what exactly it is. So there is a confusion about the quality of the PPE. That is well true. And even nurses and other people also tell me like, how are we sure about wearing this PPE would prevail because looking at the quality, and still people use it because it's a protocol. They know that okay, something is better than nothing, and that is the reason they're following it up.
Hmm. What about children? Because what Dr. Roma Kumar right now mentioned is that there are also instances of children being impacted in this wave. How equipped is our medical infrastructure to deal with this? Does it mean that nurses and doctors have to go a step ahead because you can't have parents in these pediatric wards where children are, and you are even more stretched while dealing with such cases?
Yeah, there are cases wherein small children got affected, and I've seen many nurses are really taking care of them very well. I mean, like as if it's on their own children, and that kind of care what a nurse and doctors are giving in the hospitals.
I know in the first wave, when you're working as a volunteer nurse, you weren't able to be there for your child's birth, and it was 4 months after which you saw your daughter. What is the situation right now with your family, and do you feel scared of passing infection to her?
Absolutely, because I have seen my newborn after 4 months because I was in Maharashtra and my family was out of state. And later on, also, when I went, I was in quarantine for 32 days because I wanted to make sure that I'm not carrying any virus. And I've tested twice, then I went to my family. So now I'm with them, but still, when I go home, I have that feeling, okay, I should not carry that virus.
But Dr. Shashwati, we recently had the Karnataka Association of Resident Doctors coming out and accusing the state government of not providing adequate medical facilities that also involve quarantine facilities for doctors who don't want to go home to their families and to protect them. Do we see such arrangements being made where you are at the moment?
Well, that's always been a huge challenge. The last year when the pandemic began, and we knew that the healthcare workers being infected was a realistic possibility. And at that point in time, when the hospitals were actually thinking how to quarantine, that is the time we as a team we really insisted, and I was one of the main people who we spoke to the administration, and ultimately the administration agreed and they tried to make some arrangements for quarantine facilities. And when the nurses got infected, obviously we made sure that they were initially admitted to the hospitals, and then once they had crossed their the time which when they needed to be in the hospital, they were put into the satellite centers, or the people who were coming from home, they were requisitely monitored in a satellite center before they were sent home, because there's this huge mental fear of going back home and being with their loved ones and the risk of infecting them.
Dr. Roma Kumar, it goes a step beyond as well because there have been cases in the first wave where doctors and nurses were told to leave the society and residential complexes because people were so scared. Do you see this bias this time round as well?
No, for this time, we don't see this kind of a bias right now. Currently, I think what the struggle is to get hold of the hospital beds and oxygen facility or any medical resources. And when that is not present, I think the anger is surging and increased irritability is seen because the public at large is very, very anxious and they are panicking and they're seeing a lot of losses, and the anger comes in that manner, but not where the societies are saying that the doctor is carrying that infection. I think we've gotten over that part.
In fact, Dr. Roma Kumar, just earlier this week, we saw a case of how a doctor was attacked by angry family relatives because their loved one lost the battle against COVID and the doctor had to bear the brunt for it. So, is there a security risk that health workers have to deal with in such situations, which could turn volatile?
Yes, one has seen that, and one has seen that pretty often. We at the hospital setups do see the anger surging up, and when the person or the patient who is suffering is feeling or is perceiving that the adequate medical help is not being given, which is a negative perception, and they are not able to stop themselves from that anger, and especially if they are seeing a loss happening. So it's not just with this present situation, but with any other chronic ailment or any sudden death or sudden medical issue that crops up. I think the person gets very emotionally charged and anger suddenly comes up.
Absolutely. Dr. Shashwati, it's the hard part of the job that you have to inform a family member that their loved one couldn't be saved. Do you feel more trauma these days because the sheer number of loss of lives that we're seeing at the moment, and you have to convey that sad news to the family?
Yes, I guess breaking the bad news has always been a difficult part of what we do from on a day-to-day basis. The unique challenge this time around in the pandemic is that several members of the same family are affected. Probably several of them are in different parts of the same hospital. Sometimes there are different relatives or different members of the family admitted in different hospitals. In fact, right now we have a family where the son is on ECMO, so severely ill and is battling for his life. The daughter is on high flow nasal oxygen. She could go on the ventilator anytime. Their elderly father, who was 83 years old, and he unfortunately had a massive stroke and he passed away. The daughter and the father was in different corners of the same intensive care unit, and the family members at home, they were pleading with us not to inform the daughter who was on the other corner of the intensive care unit. So this is an unprecedented
Oh my God.
scenario again. And so we've still not told the daughter. We have spoken to the other members of the family, and they insist that, she will give up the fight if she knows that the father, whom she admitted a few days ago, is no more. So what can be a more difficult part than this?
Absolutely, absolutely. I mean, hearing this, I literally feel choked inside because this is what the situation has come down to in major cities of India. It's worse in smaller cities. Jibin, do you feel a sense of burnout with all that's happening around you?
Absolutely, absolutely. Because we're looking at the situation and looking at the way we all work. I mean, looking multiple patients at a time, and losing many patients, and handling emotions. We are all literally burned out. And earlier we used to handle only few patients, but nowadays we are handling hundreds of patients. But when we handle now like hundreds of patients, we are losing also. But earlier, like we have a good recovery rates, but now that is not there, and we cannot see that the patient is getting satisfied and leaving the hospital completely. We are losing young people. We are losing entire family, and there are a lot of incidents, and top of that the workload. So putting all together, we are all burned out completely, and it's a very difficult time for all of us.
But is there a provision for mental health counseling for nurses and health workers in hospitals in the region where you are?
Not really. I've not seen any counseling centers or any counseling facility for nurses. I mean, when I look at public hospital or maybe private hospitals, they do not have any facility to have a discussion with the nurses or to address the nurses' issues. So that is a major issue right now, because everyone is overstressed because of all these
Yeah.
issues. And I think that is a one point where we need to focus the counseling of nurses, and giving them an option to address their issues.
Absolutely. What about you, Dr. Shashwati? Where you are at the moment, what are the arrangements that are made for you and your team where mental health can be discussed and where doctors and nurses who are overwhelmed can just take a break and try and recover from the trauma that they're seeing and then get back to work? Is that a luxury as well now?
Unfortunately, even the recognition of the fact that the nurses and the doctors are being burnt out is probably not there. Unfortunately, the demand and the stress on trying to accommodate patients, trying to get the whole thing running is so high that even the recognition that the people who are working on the front lines, that they can be stretched to the limits, that they can be burning out. I don't see a recognition or even taking cognizance of the fact is also there. That's a very unfortunate aspect. In fact, yesterday I met my nursing in charge of the unit, who is now having to distribute her nurses between two intensive care units. Like I said, the number of patients have gone up, but not the manpower. So she broke down when she met me, and she said that, I've been working for 8 to 10 hours every day, tirelessly trying to make sure that things are fine, but I've reached the end of my patience. I'm just absolutely unable to cope with it. She was in tears. I could not hold back my tears. And these are the people who are working day in and day out to take care of patients. And like Dr. Roma said, if we don't take care of ourselves, how are we going to even take care of the patients? Unfortunately, there is nothing, no system to address this issue.
And it's an unending cycle, isn't it? Because there are no breaks, there is no work from home, there is no luxury of even stopping and taking a breath for health workers. And Dr. Roma Kumar, in such kind of a scenario, what kind of long-term impact are we seeing on the mental health of our health workers? Because what kind of post-traumatic stress disorder some of them might have to deal with?
Yeah, so this pervasive sense of hopelessness and helplessness, you know. And I would say, in fact, it's so unrecognized and unaddressed that medical health workers will also be having mental health issues. I think even at this point, take care of the nurses or the doctors who are working beyond their hours to even give them 10 minutes chats, just going there and helping them or helping them vent out. I think that's going to make a lot of difference. And also, the hospitals must have a dedicated helpline only for the doctors and the healthcare workers. Then each one of us doctors do not also think that the trust is not there. So you can just come, talk, and the trust remains, and you get some added help from there.
Absolutely. In fact, Dr. Shashwati, the resources allocation is also important because right now, India, according to the economic survey, has one doctor for nearly 1,400 patients, while the World Health Organization recommends it should be one doctor for at least 1,000 people. But what more can be done to help them at this point of time?
I guess another important aspect which needs to be focused on is because of COVID, there are a lot of areas in the hospital, a lot of departments in whom, because of the COVID scenario, their workload has gone down significantly, like the surgical specialities. It would be great if actually the entire workforce could be mobilized. At least in some ways they could be able to help the nurses and the doctors who are working absolutely on the front line. So maybe they could take care of less acutely ill patients. Then I'm sure that the load on just a few healthcare workers who are facing the brunt of the entire workload would be significantly reduced.
Jibin, the last word to you then, because do tell us what motivates you and your message for the other nurses out there who are doing their duty and making us so proud, even in these trying circumstances.
The first thing what I've seen with all the nurses is that they have come to the profession by their own choice. So that itself we can see their passion and their dedication towards the profession. And what it motivates for me is that when I look at a patient, when a patient discharged from the hospital and leave the hospital, we have some different feeling. And when somebody tells us, okay, we are cured, and it's because of the team what you have it here in the hospital, and that's how we get motivated ourselves.
And that's the story of hope. That's the story of success. And that is reinforcing our trust in the human values and human spirit, isn't it, Jibin, to save as many lives as possible? And it's only happening because we have true heroes, the corona warriors, doctors and health workers like all of you. A big thank you for joining us on the show, Dr. Roma, Dr. Shashwati, and Jibin. I wish you all the best. Thank you again for taking our time.
Thank
Thank
you.
you.
Thank you.
Thank you so much.
And as we wrap up this program, we wish that you and your loved ones stay safe in this pandemic. You can write into us at Delhi_WorklifeIndia at bbc.co.uk. You can even tweet your comments about the program using the hashtag WorklifeIndia. And till we meet next time, it's Namaste from me, Devina Gupta.